Yeah, sure.
I think it is. Yeah. Hi. Hi, Hari. Hi, Dana. Good morning. So thank you
Hi,
both of
Sudha. Hi,
you
Dana.
for
Good morning.
joining on this Saturday
Yeah,
morning. Okay, I'll give a brief
yeah.
introduction on Hari. We were just chit-chatting and we were having a very lively session before we went on live. So we thought, okay, we should save it for the live and not exhaust all our sharings before. So Hari is a very young caregiver. I remember him from the time he started messaging me when he was living or when he had just come back from Australia to Chennai to take care of his mother who has been diagnosed with Parkinson's. So initially, I would get these very detailed WhatsApp messages, about his mother's condition and where can I find a good doctor, who is a good doctor in Chennai, where is a good physiotherapy center, where can I go take her for a test in Chennai, which is a good center. And I was like, who is this gentleman always asking for which is the best place to go in Chennai? So I thought, okay, I need to have a talk with him to find out what is going on. So I remember talking to him and I realized he had just moved back to India. So he was trying to adjust to how things work here. At the same time, trying to ensure his mother gets the best treatment wherever she goes. So it's been a couple of years since then. On and off, we hear from Hari on how his mother's condition is and if there is anything that we can help her. She is a very one of the most adorable members that we have. When I first saw her, because I have already always seen her a mental image of hers in from my conversations with Hari. Oh, she's sick like that, she's like this. But when I finally saw her on video, I'm like, oh my God, she is so adorable. This never came up in the conversation with Hari. She's just so sweet. So she is now part of our yoga, Illadana. She also does speech therapy. Does she do speech?
Yoga, not speech therapy.
She was
Yoga,
an art.
physiotherapy, and that art. What is that
She
art?
was part of her integrated. Oh no, she was just part of the your physiotherapy with Deepa, and it really went well with her. And once I had a feedback session with her, and I had so much fun talking to her. I was like, wow, this is much more fun talking to her than talking about her with Hari about oh she's having this problem, that problem. She was so lively, very. What can I say? There is like a light in her, and there is like a life in her which just shines through in smile and the brightness that she has. So finally, after talking so much to Hari, we thought, okay, we need to have him on live to discuss some challenges specifically, because most of you would know that Parkinson's affects men mostly than women. So the typical bracket is a male who is older with Parkinson's, who is typically supported by his spouse who is also older. Kids sometimes live in India to support, and by chance, if it is not possible, most of them live abroad, and there is a struggle of caregiving from far away. But in this case, because Madam is affected with PD, Hari has moved back from Australia to take care of her. So he falls in this unique category of a male caregiver, a child who is young, who is a working professional, who is also single. So in a sense, there are much more challenges to this balancing, personal life, professional life, and caregiver responsibility. So we thought it will be interesting to get his take on it. So I have given a long introduction, Hari. So why don't we hear a little bit about you? So what were you doing in Australia before you came back?
Oh, thanks, Sudha. Thanks for the brief introduction. Very kind of you. So, to be in a precise manner, now I was in Australia for about 5 years, and I was abroad over 15 years, roughly, basically out of India. So I was before in Singapore, and I was working there, and then moved to Australia and did my uh, doctorate there. So I was doing my doctorate at that time. So in Australia. So my mom got diagnosed with Parkinson around in November 2018, if I'm not wrong, towards the end of 2018. So it was all fine. I mean, she got, and that time I didn't know the seriousness or the intensity of Parkinson. I know Parkinson is some kind of a disease. It's not just like a headache, migraine, or some very common thing. It's something uh, not a common thing. I thought it was a very rare thing and she got, but I didn't know the severity of it at that time. So she was okay actually. She was doing her work and Allame. So I was continuing with my studies. So the point is, it didn't affect my studies much. And as years progress, I think around 2019, towards end of 2019, she had a fall and had a fracture in her near her hip. It was a very mild fracture, but she had it. That aggravated Parkinson. So she had to take a bed rest completely for a month or two. And I was in my prime phase of my PhD, where I had a lot of work stress. And hearing about her fracture was like literally alarming. So I just ran back. Actually, end of 2019, I came back here for about 2-3 months to take care of her. And Appa was only taking care of her. And of course, my family members, I should say here, all of my family members were very supportive. My uncle, my aunt, they took care of her. But the thing is, they are also equally old, plus 60 plus, and they are also not that active in terms of social thing, knowing outside their people, society, getting to find the doctors. You know, they are not very active. They are typically a bit of old generation thing. They just to look at yellow pages now to find numbers on the madri. So my presence was still needed in spite of people being around. So now one there, and then doctor said nothing. You have to rest, bed rest. But I think this is the right time for me to tell this, because I don't know how many members would have faced this issue. That was the time I was searching for people in Parkinson's thing, and I found Sudha madam and this Parivarthan group in Facebook. So I randomly messaged. I was seeking help from everywhere because I'm new to India, and I have no idea of the doctor's facility here. Even though I come and go, it was very family thing. So I had the help of Sudha. Luckily, I got to know about Parkinson. I got a membership there and everything. என்னாச்சு ஃப்ராக்சருக்கு அவங்க அட்மிட் ஆயிருக்கும்போது the neuro doctor in that hospital was telling, Parkinsonக்கு there is a new therapy or the medicine called apomorphine, if I'm not wrong. Thing அது போட்டா அவங்களுக்கு நெக்ஸ்ட் 2 ஹவர்ஸ்க்கு நார்மல் ஆயிடுவாங்க, அப்புறம் திருப்பி பழையபடிக்கு வந்துரும். அந்த மாதிரி ஒரு இன்ஜெக்ஷன் ட்ரை பண்ணலாம் அப்படின்னாங்க. As I don't know anything about it, I was always thinking, okay, ஒரு டாக்டர் அவ்வளவு சொல்றாரு, ஒரு நியூரோ சர்ஜன், let's try, because she was அது என்ன எடுத்து one of the biggest complications it got is பார்க்கின்சன்ல அம்மாக்கு வந்து அந்த 5 நாளைக்கு வந்து பார்க்கின்சன் மெடிசன் ஸ்டாப் பண்ண சொல்லிட்டாரு. She was already bedridden because of the fracture. அதுல பார்க்கின்சன் மெடிசனையும் 5 நாளைக்கு ட்ராப் பண்ண சொல்றாரு, 5-6 நாளைக்கு. So என்னாச்சு, she became totally like a numb person. பேச முடியல, எழுந்துக்க முடியல, உட்கார முடியல, ஸ்டிஃப் வந்து ஃபர்தர் ஸ்டிஃப் ஆயிடுச்சு. அப்புறம் அப்போமார்பின் போடும் பொழுது ஒன்னும் பெருசா எஃபெக்ட் தெரியல. அந்த இன்ஜெக்ஷன் வந்து ட்ரையல் மெத்தட் பண்ணுவாங்க, 1 ஹவருக்கு ஒரு தடவை இல்ல 10 மினிட்ஸ்க்கு ஒரு தடவை இன்ஜெக்ஷன் போட்டு which dosage is suitable for her, something. She was just, I think, used as a guinea pig, or I don't know at that time. அப்ப என்ன ஆச்சு, she did not have any big effect of power. அதுக்கப்புறம் டாக்டர் told to resume the Parkinson medicine. ரெஸ்யூம் பண்ணதுக்கு அப்புறம் she slowly came back to normal, but என்ன ஆச்சு, with lot of side effects. Previously the medicines which she took with 0 side effects now started giving extra side effects, like பயங்கரமான hallucination, பயங்கரமான தலை சுத்தல், அந்த மாதிரி எல்லாம் கொடுக்க ஆரம்பிச்சிருச்சு. And we had a very very tough time that time. And அப்போதான் I had to continue my stay here for another 3 months. January, I mean starting of January 2020. So I did my studies from here, and I took care of her, and walking problem ena, fracture, the physiotherapy ella slowa panni, but the hallucination was very much bad. And that is the time I should really thank Dr. Avias, A.V. Srinivasan, my paternal side aunt's husband. My uncle got Parkinson and he was treating. So my auntie suggested, why don't you go and see A.V. Srinivasan? I don't know who's Dr. A.V. Srinivasan that time. I just know, okay, someone is telling someone, let me go. Pone, and he changed completely some medicines, dropped few medicines ella. and then slowly she started becoming better.
I have to
So
take a
and
pause here, Ravi. Hari. My God, I didn't know she got apomorphine. Actually, I'm very surprised. I
ama
didn't know this.
that doctor was testing on her illa enna
I'm
basis la
sure.
she
I'm sure. This is really shocking. Um, my God, I really
if at
thought I
all she
knew
has
so
not
much.
been falling, if at all she was not fallen, fracture ஆகாம இருந்திருந்தா and apomorphine கொடுக்காம இருந்திருந்தால் she would have been in a much better position
Much
now.
better
அது
position.
ரெண்டுமே
So true.
aggravate பண்ணிடுச்சு her condition.
Ama. So
And
just
I
for
was very
people,
naive and I was
exactly. We don't know. No, nobody knows. I mean, just for people who are watching this, I would like to say that apomorphine is it's typically a rescue medicine. அதாவது எதுவுமே ஒர்க் ஆகல ரொம்ப வருஷமா பார்க்கின்சன்ஸ் இருக்கு they have been living with Parkinson's for a long time. Medications for Parkinson's no longer have an effect on the person affected. Then if there is a necessity for the affected person to do some physical activity like go for a function or sit up for some time or walk or do something, so you then give an apomorphine injection which will work only for an hour. And after that, I have heard personally that when it weans off, they become more disabled in terms of physical mobility. And this has to be continued every hourly medicine. So apomorphine is not a medicine that you give like Syndopa or other dopamine medicines, which can be just taken and the effect lasts for 4 or 5 hours. It's not like that. So for him to give this to somebody like your mother, who was actually, responding well to the typical Parkinson's treatment, I don't know what was the need. It is very shocking.
I don't know, it is shocking. And moreover she was already bedridden for fracture.
Yeah.
அப்படி இருக்கிறவங்க கிட்ட இதை ட்ரெஸ் பண்ணணுங்கிற அவசியமே இல்லை, ஏன் பண்ணாங்கன்னு தெரியல. பட் எனக்கு அப்போ இந்த அளவுக்கு ஒரு கிளாரிட்டி ஐ டென்ட் ஹேவ். So I was thinking whoever does whatever thing to cure my mom is fine for me. So I believed. But that episode got over, and I should really thank now Dr. Avias on this note, because he completely reversed the thing, and she gave me a good improvement. But enachi already these two had an effect on my mom's mobility and stuff, so she has become what she is now. So that was my story. So I went back to Australia so to continue my studies, hoping things will be okay. And then last 2020 August we got the COVID time. So that is the time when my mom started feeling breathing problem. She had a breathing problem, and they were not able to diagnose why is this breathing problem. It is because of Parkinson, or it is because of actual wheezing thing, or it is because of COVID or whatever. And we took all the tests, but COVID negative. But ortho எதுவும் இல்ல, ஜெனரல் மெடிசன் கொடுத்தாங்க, அதுலயும் பெருசா எஃபெக்ட் இல்ல. So it was very confusing. That was a time when breathing problem, and it's confusing to diagnose what it is. I was feeling very anxious there, because you don't know the diagnosis. இல்லையா?
Hello, can you hear me?
Yeah,
Sorry.
I can hear you.
Yeah.
Okay.
So that is the time when I thought I should come down to India for good, at least, or for some time.
No, I remember that time, because I think that's when you reached out to us. I remember exactly this time. It was early in the pandemic, and then Hari would keep messaging, asking, இந்த மாதிரி அம்மாக்கு problem இருக்கு, where should we go? Correct.
Hello.
என்ன ஹரி வேற மாதிரி வரீங்க? Okay.
இல்ல, sorry, I got a call.
Yes,
so
yes,
sorry for the
no, I was just telling Dana and others that that's the time you actually contacted us, because I remember distinctly we were all under lockdown, and you were constantly asking, my mother is having these symptoms, she's going through this, so where do I take her for test, what do I do? So that's, since then is when I remember madam's medical history very well. So when you came down during COVID, did you decide to stay back?
Oh yeah, I was having a strong plan of staying back for quite some time to get this thing sorted, not to go back immediately.
Okay.
But and also COVID was a situation where you have no idea of whether you will go back or not also. Ella borders closed, and I had a very big ordeal to come back to India. Lot of procedures and stuff.
Correct.
So
Have you not gone
அதெல்லாம்
back
முடிஞ்சுது.
since, Hari?
So இல்ல, I have not, because
not
the
gone
reason
back.
is getting back is easy, but coming back again in terms of emergency is going to be a tough job for me.
Yeah.
So adanal I'm waiting. So I'm waiting for situations to be fluid.
Yeah. So just to follow up on a couple of
Travels
things.
a lot.
Yeah. So have you finished your PhD now?
Yeah, I'm done with it. I finished from here. So I
you
did it
finished
from
here.
here. I had to complete. Yeah, I have to do. So that was one of the
Good.
challenge. நான்
Congratulations.
படிக்கணும்.
அப்புறம் உங்களை டாக்டர் ஹரின்னு தான் நான் சொல்லணும்.
Technically, yes. Yeah.
Wow, then anyway, we'll refer to him as Dr. Hari. Anyway, so that's good.
But
So, so you finished, which is nice.
There are real doctors there. Yeah. Number. It is fake doctor.
இல்ல. Doctorate is a doctorate. Okay, good. So are you working now? What are you doing now?
Oh, I'm working as a lecturer, part-time lecturer back with my university there.
Okay.
So
you
doing
teach
research
online,
and
obviously.
stuff. Yeah, mostly I'm not into teaching. I'm into research. So I just train my students and do research online, whatever from source I have, which online enna panna mudiyumo. I'm doing it with that.
Okay, based on my own experience and generally understanding how things work, because when you came in 2020 to deal with a medical emergency, you thought, okay, I'll be taking a long break from, whatever I'm doing there. Not in a break in a sense, I may not go back immediately, but you didn't think you won't go back for 2 years, and you don't know when you'll go back now. So this sudden shift of relocation for you, how has it been for you emotionally and mentally? Like, how much do you miss your friends there, your life in Australia? It's very different from your life in Chennai and what your day entails in Chennai. So is there like a disconnect? How do you feel?
Oh, I mean, a big disconnect actually, because when I came here, my mind was totally blank, because honestly, I didn't have any idea of my studies or whatever. I was only focused on mom getting okay and me going and helping them. அது ஒண்ணுதான் இருந்தது நான் வரச்சே. I didn't have any other thought, because it was a very peak of situation. She's not well, வீட்ல பாத்துக்க முடியல, COVID, and lot of things. So I was not able to even process the negatives and positives, or what I will miss, what I will not miss. I was just like a machine. I was just working towards coming here.
Problem solving.
So once I got settled, or getting to settle things here and slowly, then I had the issue of this drift, because I have never been in India for such a long time, continuously, because I used to visit here often, but இங்கேயே இருந்ததில்லை கண்டினியூஸா. ஒரு வந்தா maximum 3 weeks or 1 month, அதுக்கப்புறம் I will go back. So it was always that kind of a visitன்றதுனால continuously staying here and acclimatizing to lot of regular routines and stuff, and the pollution, everyday activity, அதெல்லாம் வந்து கஷ்டமா இருந்துச்சு.
Correct.
To be very honest,
yes. And also to do anything here is very different from how we would do it abroad. So yeah.
Very so I get very angry in everything. Bank pona I start yelling at people. Why? It's a simple task panna vendithane. So because I didn't know I know India is not as enna solradhu procedurized by like others, but when you face it, you will feel the heat of it. You have got used to doing things in a minute of time, and it takes for days here. So you have this. So the drift was there, and of course I had to submit my thesis. I have to finish off my stuff. So and the pressure was very high on me, because every day what happens, even today, I mean till date, you taking care of them and doing the necessary household stuffs for them and arranging will take some time and energy, more than time, the energy. So by the time you settle down for your work, you feel exhausted a bit.
Yeah.
So
mostly mentally
and you feel
than
like,
physically, right? Yeah.
And then you feel, chalo, let's do it after some time, or chalo, let's do it tomorrow. And the tomorrow never comes. It keeps postponing, So few of your personal critical work which you have to do, you get it delayed. Back there, you have no issues. You just get up, do your morning things, and start your work. Right?
Correct.
But here you can't do that. By the time you start your work, it's already half past 11 or 12. So you become a bit drained. Adalla எனக்கு பெரிய challenge even till today for me to set the plan. And அது பெரிய விஷயமா இருந்துச்சு. Second, cultural difference இருந்துச்சு because I was so independent. I don't need to answer anyone to where I go, when I will come back, what I will eat.
Do they ask
what
you
am
now?
I doing?
இப்ப கேக்குறாங்களா வீட்ல எத்தனை மணிக்கு திரும்பி வரேன்னு?
ரொம்ப கேட்பாங்க. நான் 10 மணிக்குள்ள வரலைன்னா எங்க வரல, ஏன் வரல, எதுக்கு வரல, ரொம்ப கேட்பாங்க. நான் வந்து சொல்லுவேன், என்னை யாரும் கடத்திட்டு போக முடியாது, கடத்திட்டு போனாலும் என்னை வச்சு ஒண்ணும் பண்ண முடியாது. So வந்துருவேன் அப்படின்னாலும் they are typically அந்த காலத்து மனுஷங்க.
They are not, I think, as much concerned about your safety. I think they are just concerned that when you will be home, so they will feel also nicer to have you around.
Yes. Yeah.
So ஒரு வீட்ல ஒரு ஆள் இருந்தா அவங்களுக்கு அதுவே ஒரு தெம்பு. So I think they mostly want you around more than something will happen.
Yeah. அதான் both the ways. So அந்த typical family bondage இருக்கும் இல்லையா, ஃபேமிலியோட அந்த கண்ட்ரோல் இருக்கும். அது வேணும், இது வேணும், அங்க போகணும், இங்க போகணும். So that keeps you very much occupied and keep your priorities next and their priorities first.
So also ending up going to lot of family functions or visiting relatives, அதெல்லாம் பண்றீங்களா?
No.
Good.
Visiting relatives, yes, and I like it, but family function, no, because every relative is very old to have any function. COVID is one thing.
Old to have a function is very funny. Okay, understood. Yeah, or they are not living here. Okay, yeah.
Because COVID also. I think I am the youngest in both my families. My dad and mom's family நான் தான் youngest நினைக்கிறேன். மத்தவங்க எல்லாம் 45 plus married and with their own knee problem, ailments. So function ஒன்னும் பண்றதுக்கு இல்ல. 40 வயசுக்கு என்ன ஃபங்க்ஷன் பண்ணுவாங்க, பண்ண முடியாது. So அதனால it's pretty much day-to-day routines and medical care.
That itself can be quite taxing. Tell me.
And career.
Yeah, I want you to tell me a little bit more. Okay, since you started career, let's go with that. You said one is it is very difficult to plan your day and work on the things that are of priority for you, right? In what way? I'm sure it is affecting your career because you can't plan, you can't work towards it. What are you doing about this?
Well, you have to stretch yourself. That is the only thing you can do because time is fixed. Everyone has the same time. We don't get any extra. So I have to stretch my time either in the night or in the early morning to do stuff. And sometimes I take a break personally, like 2 days total away. I'll make arrangements for them to manage, and then I go somewhere. Not to visit places, but just to finish off my backlogs. அந்த மாதிரி. So அப்படித்தான் adjust பண்ணணும். It helps to some extent, but not completely. But that's how you have to do. If you are the primary caretaker and you don't have any big support, equally young, இப்ப எனக்கு ஒரு தம்பியோ அண்ணனோ equally young and சுறுசுறுப்பா இருந்தாங்கன்னா probably I would have had a much less என்ன சொல்றது, commitments. Stress and commitments.
Are you the only child, Hari?
Yeah, I am.
Okay, no siblings at all. Yeah, that does put a pressure,
No
to be the
siblings,
only
no.
child. So, but also as I was telling you before, I've also noticed that even if you have, like, say 2 or 3 siblings, it always ends up that only one child is taking care. I mean, when I mean child, they'll be in their 30s and 40s, but it's only the one kid who is there available. But what is good for that one kid is you can discuss your parents with other siblings. அம்மாக்கு இப்படி இருக்கு, அப்பாக்கு இப்படி இருக்கு, நீ என்ன நினைக்கிற, போலாமா வரலாமா. So somebody will visit from abroad, they'll relieve you for a couple of days. So there'll be some give and take, although only one person is the main caregiver. But I think that is a bit difficult for you. You lack that support, I think.
Correct. Actually, எப்படி நான் சொல்வேன்னா, if you have some siblings or someone of your age and wavelength, one thing is you may be the person who is always doing the stuff and they may be dormant or passive, but when you need some break, at least they can take up your position.
True.
So அந்த ஒரு என்ன சொல்றது, ஒரு ஸ்டாண்ட் பை இருப்பாங்கன்னு ஒரு அதுவே இட் வில் கிவ் யூ மென்டல் ஸ்ட்ரென்த். ஓகே, நான் இல்லைன்னா கூட இவன் பார்த்துப்பான் அப்படின்னு சொல்லிட்டு. Secondly, decision making is a big thing which I faced because Appa does all the decision making, but in terms of technology or in terms of quickly doing decisions and seeing a doctor or getting a medicine, he is afraid. As he gets age, and they also எல்லாத்துக்கும் பயப்பட ஆரம்பிச்சிடுவாங்க. So immediately take a decision and give a treatment or do something. அவங்க செய்ய மாட்டாங்க. So I have to take. அப்ப நான் வந்து டிஸ்கஸ் பண்ண முடியாது. I have to, personally take a chance of taking a decision.
Yeah. It's all only
that
up
is
to
one
you.
thing, because you can't discuss with your up to me. So that is quite a bit of mental challenge. It requires a bit of very because I think I'm better with in terms of what's happening around with Parkinsons and related people. But முன்னாடி it was very very tough for me. ஏன்னா ஒரு சின்ன மெடிசன் கொடுக்கணும்னாலும் I will think 1,000 times, and it reacts in a different way to her than to us. இப்போ நான் ஒரு மெடிசன் சாப்பிட்டேன்னா either it will have some effect or zero effect, but அவங்களுக்கு வந்து it gives an adverse effect if it doesn't work.
Hari, tell me one thing. How independent is Amma in terms of mobility?
Well, she's okay. I won't say totally independent. Sila naal she walks, sila naal she doesn't walk. I mean, she struggles to walk. And always she has a feel that she is not walking. Even when she walks, I say, you are walking, பரவாயில்ல ஏதோ பண்றியே அப்படின்னா, இல்ல நான் வாக் பண்ண. ஆனா she has this mind, எனக்கு பழையபடிக்கு நான் நடக்கணும், சமையல் பண்ணணும், கோயிலுக்கு போகணும், அந்த ஒரு தாட் இருக்கு. And so அதனால it's on and off. Sometimes she really walks okay and manages stuff. Sometimes she struggles to walk. அது அந்த ஒரு sinusoidal system இருக்கு.
அதான். So இப்போ bathing, self care, தலவாறுறது, குளிக்கிறது, dress பண்ணிக்கிறது எல்லாம் அம்மா பண்ணிக்கறாங்களா?
பண்ணிக்கறாங்க, பட் ஆனா ஹெல்ப் வேணும், கூட யாராவது இருக்கணும்.
So who is with her when she does all of this?
அப்பா தான். அப்பா 24/7 he is with
her all the time.
ஆமா.
How old is Appa?
Because அப்பா 76.
Yeah, he's also older. How is his health?
He's very old. I mean, he's okay. And he is a diabetic patient. அதனால வந்து அந்த நடக்கிறதெல்லாம் கொஞ்சம் கால் வலி அதெல்லாம் இருக்கு. And both are managing themselves.
Do you have someone to help with cooking? யாராச்சும் சமையலுக்கு வராங்களா?
இல்ல, அது வந்து சமையல் பண்றதுங்கிறது எங்களுக்கு செட் ஆகாது.
Correct.
So I get food from I buy it. Currently I'm buying it from outside. And whatever is necessary, light mild cooking we do.
Okay. அந்த வெளியில வாங்குறதுல எல்லாம் இருக்கா?
Manage. Okay. I mean, we order from the house home cooked food, and it's quite
decently fine.
Because problem again comes is it's all commercial outside. So for us it's okay. You can eat anything, but for them nutritious ah irukano, nariya vegetables irukano, oil kammiya irukano, reused oil in the criteria irukku, because you need to give them good nutrition. I can live with noodles 7 days, it's no problem, but avungalukku you have to give some good vegetables in a good quantity.
Even you also need good vegetables. You can't eat noodles 7 days.
I'm just
we
telling
need to
for
address
comparison.
That. No, because why I'm saying that is, if somebody is coming home to cook, as much as it is a help in cooking, it becomes more work for you. அவங்க டைமுக்கு வராங்களா, அவங்களுக்கு வேணுங்கிறதெல்லாம் காய்கறி வாங்கி வைக்கணும், இன்னைக்கு என்ன சமைக்கிறதுன்னு அவங்களுக்கு சொல்லணும், சமைச்சதுக்கு அப்புறம் அதெல்லாம் க்ளீன் பண்ற கால் வராங்களான்னு பார்க்கணும். So although there is somebody helping with the chore, it is also a responsibility to supervise, and that will also take up your time, and that your parents can't do. And the follow up alla திருப்பி நீங்க தான் பண்ணனும். So it will be
I prefer this is much easier. You just get the food from outside,
and your parents are okay with it. They are not saying anything. Ayyo idhe ipdi irukka apdi adala onu complain பண்றது இல்ல.
They were initially initially they were not okay because they were never used to such things, but I forced it. I made a decision that I said you have to do it because appa has to cook if mom cannot. I can cook, but the thing is then I'll be end up doing only that thing and not my work.
ஆமா, அப்புறம் சமைக்கிறது
So
லேட் ஆச்சு.
um so appa cook panna by he has to take care of mom, cook everything. He becomes so exhausted.
Yeah.
And
it's a good
he
idea,
can't do that every day, you know.
In fact, this is a good idea even if the situation is the reverse. What I mean by reverse is if it is the gentleman of the family who is affected with PD, then the wife also need not be burdened with cooking and with caring for her husband. Appa kuda they can do some, provision like this to get food from outside. So anybody listening to this, I mean, inga sonna madri, they'll not be open to the idea, especially if the lady of the house doesn't have PD. Then they'll think, enna na samaikama edukku, நான் பாத்துக்கிறேன், அப்பாவே நானே பார்த்துட்டு நானே சமையல் பண்றேன்பாங்க. பட் அவ்வளோ ஒர்க் தேவையில்லை for anybody, and that exhausts you physically. Like how we were talking, caregiving is just one role, right? How are you being supported to do that role determines your mental well-being as a caregiver.
I think நம்ம வந்து ஆஃப்லைன் பேசும் பொழுது caregiving as a single person is different from caregiving as a man with a family or with other siblings. Enna you have distractions,
right?
So for example, what I notice is Parivarthan le nariya members irukanga, avanga ella family men and quite in their 40s and plus. What I notice is avangalukku the effect of their loved ones being affected by Parkinsons வந்து absorb ரொம்ப ஆகிறதுக்கு முன்னாடியே they got other commitments to work on. இப்போ உங்க அப்பாவோ அம்மாவோ உடம்பு சரியில்லாம கஷ்டப்பட்டு இருக்கும்போது கஷ்டப்படுறாங்களேன்னு நீங்க ஃபீல் பண்ண டயத்துக்குள்ள உங்க பையனை நீங்க ஸ்கூல்ல போய் விடணும், அவனுக்கு ஃபீஸ் கட்டணும், அவங்க ஒய்ஃப். So இந்த distractions helps you from sinking into the
see, it's the end of the day, it's a mind thing, it's not about the physical work. இப்போ நீங்களா இருக்கட்டும் ஹரி, இல்ல இப்ப somebody else who is married ஆ இருக்கட்டும், both of you will love your parents the same way, both of you will care for the parent in the same way. வேணுங்கிற டைம்க்கு மெடிக்கல் இன்டர்வென்ஷன் பண்ணுவீங்க, சப்போர்ட் குரூப்க்கு ரீச் அவுட் பண்ணி தேவைப்பட்ட ரிசோர்சஸ் கேட்பீங்க, எல்லா இன்டர்வென்ஷன் பண்ணுவீங்க. But what I feel is in your case, because number one, you are the only child, number two, you're also single without any other commitments, it is easy to get sucked into the whole drama of caregiving. If amma falls sick one day, it will just seem overwhelming just to deal with that. I mean, you will do all of it nicely.
Yes.
And you have been doing it. I know you have been doing it for the last few years. But the strain it takes on you, the amount of stress it causes in you will be much, much more than somebody who is having like a support system within the house, I think.
Yeah. That's very true. Amma. For example, if I do a day's work good, it only starts when she is normal. If I find her own normal, she says, okay, I'm fine. Then I have a good mind to do my other work. When she morning எழுந்திருச்சுக்கும்போதே she is dizzy, she has breathing problem, she has that neck. நான் என்னோட whole day of plan வந்து mentally got stuck, physically got stuck.
And over, Hari. I've heard this over and over, and I've also felt it personally. So a caregiver's good day is whoever they're caring for, if they have a good day. Because your sense of identity is completely, unfortunately, merged in the person you're caring. So, see, even when my father was like bedridden, like that day, if he'll open his eyes and then do some physio, it's a great day. Then I'm like so happy that day, and I'm a nice person that day, and my mother will be happy to be around me. And like full life, he's having his eyes closed and didn't do physio. It's a horrible day for me. I will be upset, I will be angry, and you know what we don't realize that time is, unfortunately, this is true. It's very selfish, but it's true. Whenever they feel good or they're doing well, of course, we feel good for them, but we also indirectly mostly feel good for ourselves. Avanga nalla irundha, if they're doing okay, they can take care of themselves, they're fine, so we can go do our thing. But when they sink, and when they need more attention, then they need more of us. Then we are like, oh my God, then I can't do XYZ that I need to do, but I need to be looking at you. And that also automatically pulls you down, I think. So it's a mix of both. One, of course, you love them, so it's hard to watch them suffer. Two, your own life suffers, so you're like, oh my god, I need to be more and more and more into this. Yeah.
இல்ல அதான் you are very correct. அது I think everyone faces this issue irrespective of whether they are single or married or
Yeah.
whatever. As I said, offlineல கூட it is என்ன சொல்றது, அவங்க everything is now centered with them,
Yes, yes.
and your attitude completely changes.
Yeah.
அதாவது வந்து அதான் நான் சொன்ன மாதிரி you change completely. You are actually the person who you take care of them. You yell at them when they do certain things.
Yeah.
அதுக்கப்புறம் யூ ஃபீல் சிம்பத்தைஸ்ட், ஐயோ சொல்லியிருக்க கூடாது, பாவம் வேணும்ட்டா செய்யறாங்க.
Correct.
ஆனா திருப்பி நீ அவங்க கிட்ட போறச்சே அதே தான் திருப்பி வரும்.
ஏன் இது பண்ற,
நாட் பிகாஸ்
ஏன் இது பண்ண மாட்டேங்கற.
சோ இது இப்ப ஏன் இது உட்கார வேணாம்னா ஏன் உட்கார்ற, குனிய வேணாம்னா ஏன் குனிற, இது சாப்பிடக்கூடாதுன்னா ஏன் சாப்பிடுற. பட் அவங்க வந்து அவங்கள அறியாம அந்த ஒரு சைல்டிஷ் பிஹேவியரை செய்யறாங்க. அது நமக்கு வெளியில இருக்கிறச்சே தெரியுது. பட் அந்த சிச்சுவேஷனுக்கு போறச்சே நம்மளுமே we are involved in it and we get out our anger and anguish. அப்புறம் தனியா போறச்சு we feel sympathized, ஐயோ செஞ்சிருக்க கூடாது, the very purpose of caregiving is spoiled.
Exactly.
So it's this emotional variations, fluctuations always there.
Yeah.
அது one of the, I think one of the main I won't say side effect, the main effect of caregiving அதுதான்.
Yeah.
Because and Parkinson, I have heard people saying appavum adhe, you have to keep them happy.
Oh, he says
and that is a real, and the real problem is when you are around them you won't keep them happy. You will always yell at them, make them force them to do something until the work is done. Physiotherapy panni mudi matra, but on the process you can't really focus on making them happy.
You will be focusing on making you're helping them physically but emotionally. Tell me one thing, how is Appa dealing with all this? Is he like patient with her? Is he okay with the whole thing?
He is patient and he's okay. Age matters. With age, I think you get a bit of stability, and of course he has his own stress in terms of other things, but we all on and off time, because amma lose temper, appa lose temper, and I lose temper, ella irukudhu, but the frequency with which I lose and they lose is different.
Exactly.
avladane veliya. So it's a bit of a,
it's an adjustment now.
Game.
And also see, for your dad, and it's also for your dad, it helps that you are around. The stress for him is much less because you are here. He will be a different sort of a caregiver if he was alone. In the role avar pannirvaru, veetla irundittu paathitu adu pannirvaru. So I think you both are cushioning each other.
But adha venum avarkum, because I made it like that. So because he can't go around, and I don't want him to go out of house quite often in this COVID situation, and make things work. So he's very enna solradhu, and the galathu person, he doesn't have the online transactions edum theriyadu, and he doesn't want to strain himself to know also, to be honest. He finds it very comfortable the way he is, and I left it to it. இப்ப போய் ஃபோர்ஸ் பண்ணி இப்படி பண்ணு அப்படி பண்ணுன்னு சொல்ல முடியாது. பட் இப்போ எவ்ரிதிங் இஸ் ஆன்லைன். Right from doctor's appointment to medicine to everything is online. So I have to do it. Amma knows a bit, but Amma can't do with that fingering and proper the texting la. So adanal naan da pananum. So it's like the main things kala I have to be present. Right. Matta routines he may take care and the mother.
Exactly. Sometimes
that's how it works.
I know. I exactly know what you mean, because even when Appa was taken to bed, there was people to do everything. There was a nurse to take care, there was my mother to cook, there was helpers to do other things. I was only supervising. In the supervisory role ke enak ivlo stress irundhu, I was actually doing the work. I don't know what I would have done. So I think we underestimate how much this decision making can be very stressful. It's not always about the physical work, to think strategically what treatment, what medicine, where to take her, which doctor, what appointment. It can all be quite energy consuming and mentally taxing. This is one question Dana always asks, which I'm going to ask for instead of do you take time out for yourself, Hari? Do you go out, spend time?
I am.
You do.
Yeah, I am. I think I should take it,
Yeah.
and I'm taking it actually because it is affecting myself and caregivers are namakkum it is benefiting,
Right.
and avungalukkum vandu it's a bit of a space you give them for them to be by themselves. So
Yes,
adanal
exactly.
always
Exactly. I think you said it
just
correctly.
always
Yeah, you said it right, because it's a space for yourself and a break for them from you also. I mean, honestly, வீட்லயே என்ன தோணத்தோன்றதா அவங்களுக்கும் கொஞ்சம் போதும்னு ஆயிரும். So that's a good way of looking at it. Exactly.
so அதனால வந்து அவங்களுக்கு அந்த I mean with COVID around, even if I wanted to, I was not able to. But now that touchwood things are trying to get back to normal, so I'm taking break for myself quite not often, but on and off.
Do you, are you comfortable with where your career is going, or are you worried that it is getting impacted or stalled?
Well, I am worried a bit because my career will be totally in a different path if I had been in Australia.
Okay.
It would have been a bit faster, or it would have been much more openings, much more opportunities, much more time and space to explore. I can put it that way. So inge adu ellame ipo irukku, but it's all in a constraint, it's just like you have a bird in a sky, it can fly anywhere. Now you have a bird and a big cage, maybe a room.
Yeah.
So it can still fly, but within the room,
That's true.
So அந்த மாதிரி தான் இருக்குது, but if you look at in terms of career, I think everyone has especially growing phase of career la இந்த problems எல்லாருக்கும் இருக்கும். But again, unfortunately, இந்த மாதிரி ஒரு ஏஜ் குரூப்ல சிச்சுவேஷன்ஸ் சிக்கினவங்க கம்மி. நிறைய பேருக்கு கெரியர் செட் ஆயிட்டு ஃபேமிலி சில்ட்ரன் ஸ்கூல் போயிட்டு ஒரு இடமா செட்டில் ஆனதுக்கு அப்புறம் இந்த ப்ராப்ளம்ஸ் வரும். ஸோ அவங்க ஃபோக்கஸ் will only be on finishing their office work and taking care of, it's like more of a day-to-day affair, not on a next 5 years what you are going to do, next 10 years ங்கிறது கிடையாது. Already they have set their base.
Fair enough.
So இப்போ base setting timeல இந்த மாதிரி வந்ததுங்கிறது வந்து it's an unfortunate thing, but you have to plan in what best
it is what
situations
it is. Exactly.
Yeah.
Exactly. And it is also difficult to break that and say no, my career trajectory will be the same irrespective of myself. That is also not practically feasible. So yeah, I understand it is tell me, I think we are almost out of time. Then please ask some questions. I'm just onnoda question naane kettiten. So Hari, is any thing that you have picked up as a caregiver on your own, like anything, the way that you deal with it, that can be helpful to, like in the madri vandadana, just avoid this or do this, not in terms of say some symptom management kekala, as a caregiver, any tips you would like to share for other caregivers?
As a caregiver, நான் experience பண்ணது and I'm trying to change myself, and the perspective is you should have a lot of patience and try to enjoy that moment when what you have with the situations, because Parkinson vandu it's an ups and downs. Suddenly they will be very active and very nice, as if your whole garden is flowering. The next few days அப்படியே டோட்டலா வந்து they will be in a zero sense. But so அந்த ஃபேஸ்ல இருக்கும் பொழுது there will be another better day coming, so don't worryங்கிற மாதிரி மைண்ட் செட் வச்சுட்டு மூவ் ஆன் பண்ணணும். And when you are really happy with them being very active, enjoy that time. Exactly. So you should travel with them and be patient ங்கிறது ஒண்ணுதான் I learned, because at the end of the day, even if you're pushing it, it's just like you are pushing a wall, because few things you can't do anything, even they can't do anything.
Correct.
So you have to just be patient with treating them and enjoying with them. And so always there is a better day after a bad day ங்கிற ஒரு மைண்ட்ல if we are, probably it will be good for them and good for us also. Adudha I try to implement. I'm not implementing yet, I am, to be honest, but I'm trying to.
No, that's a very good insight. That's a very good insight. And we have heard a lot of caregivers again and again say how much patience it requires of them. This is coming from a lot of caregivers who are older, who are women, who are used to being patient, who are used to being
Yeah,
tolerant of domestic situation. They say, கேர்கிவிங்ல என்னம்மா கத்துட்டீங்கன்னா பொறுமையா இருக்கணும்மா அப்படிம்பாங்க. அப்படியே it's a bit and if it's really sometimes heartbreaking when I hear like an older 65-year-old lady say that after being through so much in life, to say you need to be just patient with this. Yeah.
because it is a different level of patience.
Yeah.
It's not
Yeah.
about sitting simply and waiting for certain things. No, the
Yeah.
patience is
Yeah.
something different. It's I don't know how to.
Exactly. தனானி ஒரு கேள்வி கேட்டு. Sorry, I just exhausted. I think he's getting a call. Hi, Kari. Are you getting a lot of
Yeah.
calls?
So, yeah. இதான் it's the typical morning
This
routine
is your
for me.
work time? Okay. Okay, Dana, over to you.
On and off. So, yeah.
சார் எனக்கு என்ன கேள்வினா, நான் கேட்கணும்னு நினைச்சிருந்த எல்லா கேள்வியும் மிஸ் சுதா வந்து கேட்டுட்டாங்க. சோ எனக்கு இப்ப என்னன்னா ஒண்ணும் இல்ல, நீங்க நிறைய கோவம் வரும், அப்புறம் எமோஷனலி பிரேக் டவுன் ஆவீங்க சம்டைம்ஸ். அந்த மாதிரி நேரத்துல நீங்க என்ன சார் பண்ணுவீங்க? சோ எந்த மாதிரி நீங்க அத டீல் பண்றீங்க?
எமோஷனல் பிரேக் டவுன் கோவங்கிறது வந்து வெரி குவைட் ஆஃபன் வரும். ஐ திங்க் எல்லாருக்குமே வரும். பார்க்கின்சன் அஃபெக்ட் ஆகி அவங்க கிட்ட கேர் கிவிங் பண்ற எல்லாருக்கும் வயசு வித்தியாசம் இல்லாம வருங்கிறது என்னோட பெர்ஸ்பெக்டிவ், என்னோட அபிப்பிராயம். ஸோ அதுக்கு நான் அந்த இடத்துல இருக்க மாட்டேன், அவ்வளவுதான். ஐ ஜஸ்ட் கோ அவே, கோ ஃபார் somewhere, so that you don't be in that vicinity for some time. That will help.
Remove yourself physically, maintain a physical distance. Correct.
Physically you move away. I think it helps a lot. You calm yourself and situation calms, and then you slowly come in. It's fine.
Yeah. I haven't met your father, Hari. I haven't met your father, but I've met your mother. I think they are all quite, online.
Is it? I think he will be always.
நான் பார்க்கல சார், பார்த்ததில்ல. Have we?
I don't know if she's seeing this live because
they both seem, from what I hear, quite calm. So I think the not calm person in the house is you only. Is it?
Yeah, I am the one person who is always agitated.
Yes.
I think my mom learned patience through this PD, because I could see her always accepting things, and yes, she breaks down once in a frequently, but அதுக்கப்புறம் she accepts it. Okay, வந்துருது தான் அப்படின்ட்டு. But the acceptance இன்னும் எனக்கு வரல, to be honest. I am not able to accept this life changing situation yet.
Right, exactly.
Because it's not a life changing situation for your person who's affected. It's entire close family around them. It's a life changing situation. Everyone's life changes. So it is that this disease is something which changes everyone's life, including themselves.
True.
Who are near to them.
True. That acceptance takes time. True. Fair enough.
So and acceptance, patience, I think we have to develop from this scenario.
Absolutely, yeah, totally. Is there like I like to ask this to most caregivers, one word you would like to describe as to your mental framework or how you feel?
Anxious, always anxious. What will happen? What if it was? What if it does? What if it doesn't?
Correct.
What about next day? What about next hour? What about next? So in the fear and anxiety is always there.
Kandipa. I can imagine.
Fear of tomorrow, so the fear is there.
Yeah.
So one word is
unsettled,
anxious.
an unsettled churn in the stomach, always,
Always, exactly. Unsettled churn, you are rightly saying. Yeah, unsettled.
And the thing is, we get so used to it that sometimes we don't even know we are carrying that anxiety all the time. So when in a time when we are happy or when we are not thinking and that anxiety is not there, even for a slight second, is when you realize, oh, it's always there. Yeah.
Yeah, that's what I think. That anxiety is what is making you feel angry, agitated every time.
Correct.
Yeah, if you don't have an anxiety, you won't feel
Yeah.
agitated.
Exactly. Why will we
So,
lose
yeah,
our cool?
so if you or me getting a stomach pain or a headache or something, we won't be anxious. You'll say, okay, marandu potta seri, I don't rest. But if they get it, you become
Yeah.
you become very anxious.
Yeah. Yeah.
So
Totally.
I think that's the trick.
Yeah.
But the anxiety is always there. I don't think you can. I don't know how to eliminate it. If someone
Yeah.
has idea to it, I will be
Yes.
happy to
Yes.
know.
So,
But I don't know.
yes. So I think what helps is, of course, do you have friends in Chennai like you can hang out with?
Yeah, I have couple of them. Yeah,
Okay.
not many because Chennai base இல்ல இப்பதான் எனக்கு base
அதானே
ஆயிடுது.
அதான் கேக்குறேன். ஆமா. So to have a circle like
So
that
I have
helps.
couple of friends. Yeah, I do have. Yeah.
Yeah. For me, what
Yeah, I
helped
have
was
couple of friends
yoga,
and I hang out.
meditation, all of that helped. அது ஹெல்ப்னா என்ன, from like 100 degree of anger it will come down to like some 80 degrees, and but that itself is இருக்கு, கொஞ்சம் குறைஞ்சிருக்கும். அதுலயே கொஞ்சம் ஃபங்க்ஷனலா ஒரு ஹியூமன் பீயிங்கா ஒரு 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 சைக்கோ மாதிரி இல்லாம ஒரு நார்மல் பர்சன், ஆங்கிரி பர்சன் மாதிரி ஆயிரும். அதுதான் டிஃபரன்ஸ். பட் ஆல் தீஸ் திங்ஸ் ஸ்லோலி
Exactly. And that, I mean, you have to find ways, நான் சொன்ன மாதிரி take off, do some activities and stuff. எல்லாருக்கும் ஏஜ் பொறுத்து அவங்க ஏஜுக்கு என்ன முடியுமோ.
Exactly. Anyway, so this was really
I think the yoga, Parivarthan yoga and this Warli.
Go on.
Yeah, sorry. I think mom likes this whirly art, or what do you call it as, the art and yoga very much. It really, I think, distracts her.
Yeah.
And I think that is a good thing for them, and namakkum and mari edavadhu activity panna it will be good.
In fact, you should be doing Varli, you should be doing meditation also, Hari. You'll feel better, I think.
I am doing, but I think I should sit in samadhi for 1 or 2 years to get into that calm state. 10 minutes of meditation daily won't help me.
Won't help. அதுக்கும் மேல முத்தி போயிடுச்சு பிரச்சனை. கரெக்ட் தான். Anyway, this was actually much lively and a fun session that we had with you. It's already been close to an hour, so I'm going to stop the live. Thank you for whoever tuned in, and others, I hope they watch this and they benefit from hearing a young voice share about your journey. So this was really amazing. So I'm going to stop the live now. But you stick around.